Hello, viewers. Good day, and welcome to today's series with Dr. Sam. And today we'll be talking about obesity and overweight. And in the outline, we're talking about the key facts of obesity and overweight. And then we'll be talking about what obesity and overweight really are. And then the causes, and then how obesity and overweight can be reduced. Obesity is a worldwide issue and has nearly tripled since 1957 to 1975. In 2016, more than 1.9 billion adults 18 years and older were overweight, and of these, over 650 million are obese. 39% of adults aged 18 and over were overweight in 2016, and 13% were obese. Most of the adults live in countries where overweight and obesity kills more than underweight. 39 million children under the ages of 5 were overweight and obese in 2020. Over 340 million children and adolescents aged 5 to 19 were overweight or obese in 2016. And the good news is obesity is preventable. Now we're going to look at what obesity and overweight are. Overweight and obesity are defined as an abnormal or excessive fat accumulation that impair health. Body mass index (BMI) is a simple index of which weight for height that is commonly used to classify overweight and obesity in adults. It is defined as a person's weight in kilograms divided by the square of the height in meters. For adults, WHO defines overweight and obesity as follows. Overweight in a BMI that's less or greater than 25, and obesity is a BMI greater than equal to 30. BMI provides the most useful population level measure of obesity and overweight, and as the same for both sexes, and it's all ages and adults. However, it should be considered a rough guide because it may not correspond to the same degree of fatness in individuals because the individual varies. For children, age needs to be considered when following overweight and obesity. For children under the ages of 5 years of age, overweight is weight for height greater than 2 standard deviation above WHO child's growth standard median, and obesity is weight for height greater than 3 standard deviation above the WHO child's growth standard median. And then for children between the ages of 5 to 19, overweight and obesity are defined as follows. For children between the ages of 5 to 19 years, overweight is BMI for age greater than 1 standard deviation above the WHO growth reference median, and obesity is greater than 2 standard deviation above the WHO growth median reference. Now, we're going to be talking about the causes of obesity. Although some of us know that obesity is genetic related because some families have people who are obese. They say it runs through the family. However, I'm here to tell you today that it could be true. There's a saying that genetics loads the gun while lifestyle pulls the trigger. However, The fundamental cause of obesity and overweight is an energy imbalance between calories consumed and calories expended globally. There has been an increase in intake of energy-dense food that is high in fat and sugar, and an increase in physical inactivity due to the increasing sedentary nature of many forms of work, changing modes of transportation, and increasing urbanization. Changes in dietary and physical activity pattern are often the result of environmental and societal changes associated with developmental and lack of supportive policies in sectors such as health, agriculture, transport, urban planning, environment, food processing, and distributions of marketing education. Now, what are the consequences of overweight? Talking about complications of overweight and obesity. Now, the raised BMI is a major risk factor of non-communicable diseases such as cardiovascular, that is mainly the heart disease and the stroke, which are the leading cause of death in 2012. Diabetes is another one. Musculoskeletal disorders, especially the osteoarthritis, is a high disabling degenerative disease of the joint. Some cancers, including endometrial cancers, breast cancers, ovarian cancers, prostate cancers, liver, gallbladder, kidney, and colon cancers are inclusive. The risk of these non-communicable diseases increases with increase in BMI. However, childhood obesity is associated with a higher chance of obesity, premature death, disability in adulthood. But in addition to increased future rates, these children experience breathing difficulties, increased risk of fractures, hypertension, and even markers that could be involved in cardiovascular diseases, insulin resistance, and psychological effects. So now we're talking about how overweight and obesity can be reduced. It is very difficult. It is not an easy task. If you ask me, it is not an easy task. Many people are willing to lose weight. They're willing to overcome obesity and overweight. But if you tell them the requirement it takes to do this, most of them shy away from it. And then this is high time we dealt with all these factors and to be able to overcome this, because the disadvantages way higher than the advantages. Overweight and obesity, as well as the other related non-communicable diseases, are largely preventable. Supportive environmental and communicables and other communities are fundamental in shaping people's choices by making the choice of healthier food and regular activity, physical activity, and the easiest choice, the choice that is most acceptable, available, and affordable, are therefore preventing overweight and obesity. In individual levels, people can limit energy intake from total fats and sugars, increase consumption of fruits and vegetables as well as legumes, overweight and nuts, engaged in physical activity 60 minutes a day for children and about 150 minutes a day throughout the week for adults. Individuals responsible can only have a full effect where people have access to a healthy lifestyle. However, at societal level, it is important to support individuals in the following recommendations above through sustained implementations of evidence-based and population based on activity and healthier dietary choices available and affordable and easily accessible to everyone, particularly the poorest individual in the society. The food industry can play a significant role in promoting healthy lifestyle by reducing the fat, sugar, and salt content of processed food, ensuring that healthy and nutritious choices are available and affordable to consumers, restricting marketers of food high in sugar diets, and especially in food aimed at children and teenagers, ensuring the availability of healthy choices of food and supporting regular physical exercise practice is in the process too. WHO has made the recommendations, and they have also adopted which are adopted by the World Health Assembly in 2004, recognized again in 2011 political declaration on non-communicable diseases. The WHO's global strategies on diet, physical activities, and health describes the activity needed to support healthy diet and regular physical activity. The strategies calls upon the stakeholders in the activities and the regions to improve diet, physical activity, and pattern in the population. So with this, I suppose we are all aware that obesity and overweight is as a disadvantage to people, and it's not a healthy lifestyle, and as such I employ and admonish we all to take opportunity of this and live a healthy lifestyle. Thank you very much, and wait until our next series. Thank you, and God bless you. You're welcome. Once again, my name is Dr. Sam. I'm the lead advocate of the Health Sentinel. Feel free to follow our YouTube page and subscribe to our YouTube page and like our videos. Share our videos for people who will need it. And thank you. See you next time. Bye.